Okay. Good afternoon, everyone. My name is Beth Harris, and I'm excited to be here today with you and welcome you back to our South Fulton Mental Health Collaborative Wellness Wednesday events. There has been a lot going on in our community over the past couple of weeks. And so today we wanted to make sure that we brought you a speaker that's going to provide some vital information about some of the resources that are available to us in Fulton County. Recently, we've Rob Pitts, who is our Fulton County at-large commissioner, for the Fulton County district. And he had some information that presented that suggested that we have mental health resources available in the county and the community that are just underutilized. So we reached out to the Department of Behavioral Health and Developmental Disabilities and got an excellent speaker for you all today. So please welcome Miss Erika Williams-Walker. She is a licensed professional counselor who currently works at Behavioral Health Program for the Fulton County Department of Behavioral Health and Development Disabilities. She has worked in this field for 18 years in the capacity of a counselor, shelter director, mobile assessor, and program manager, and almost 14 of those years have been with the Fulton County government. Mrs. Walker received her bachelor's degree in psychology from the University of Tennessee at Knoxville. And I'm going to break out with a little hive right here because she has Go Vols. And she also has her master's degree in counseling psychology from Argosy University. Her superpower is being a connector for anyone who's seeking services, and she specializes in working with women who have experienced trauma, substance abuse, mental illness, and or homelessness. In her current capacity, she oversees outpatient behavioral health provision of services, developmental disability services, accreditation requirements, and federal grant focused on COVID-19 and access to behavioral health services. So she's very excited to talk to us about the services that are available. So just give us a round of applause so she can share her superpowers with our community, and welcome Ms. Williams-Walker.
Thank you so much, Beth. Let me share my screen. Okay, and so today, again, as Beth talked about, I will be sharing an overview of our child and adolescent services that we offer here in Fulton County. And our motto is we serve because we care. Again, I am Erika Williams-Walker. And then at the end or throughout, we'll have an opportunity for everyone to ask questions. And so it's just important to understand, you mentioned Chairman Pitts. And so Fulton County, of course, is governed by a board of commissioners. There are a total of 7 commissioners. Chairman Pitts is at large, but 6 of them are in particular districts based on the area that they were voted in. But all of them, represent Fulton County in general. And just to speak to Fulton County's commitment to behavioral health services for its citizens, in this year's budget, the Fulton County Commissioners allotted over $17 million towards behavioral health services. And that is a significant amount of money, and it speaks to the county's commitment to being able to offer various services to citizens that are experiencing mental health concerns. And so we offer services to adults as well. But my presentation today will focus on children, adolescents, and emerging adults. That emerging adult population is that 18 to 24 population that they are considered adults, but just from an emotional development standpoint, they need like more specialized services than would be available to, someone that is over 24. And so first, just to show you that we have child, adolescent, and emerging adult services at 4 different locations throughout Fulton County. And there's services in North Fulton, there's services in Central Fulton, and there's services also in South Fulton. And so the phone number I have listed there is a generalized intake number, and that number can be called for appointments at any of these locations. So we have Adamsville Regional Health Center, Fulton County Clubhouse for Youth, North Fulton Service Center, as well as Oak Hill Child, Adolescent, and Family Center. And I'll go into more detail about the services that are provided at each of these locations. And so our core services, the core services are the services that are offered at Adamsville, Oak Hill, as well as North Fulton Service Center. And core services center around you getting into therapy, a behavioral health assessment is initially what is conducted. Also, there are psychiatric evaluations, nursing evaluations. Persons can receive either individual or family therapy, diagnostic assessments. There are some addition services, referrals, crisis intervention, as well as medication management. And so core outpatient services really focuses on what are some of the core issues that the person is experiencing and get them into services based on that. It is the department's goal to offer no to low cost and barrier-free access to services for any Fulton County resident. And we serve anyone, whether they're insured, underinsured, or uninsured. And so again, we want to be the doorway for anyone that needs that help to be able to access those services without having to, jump through hoops. Right now, we're offering a modified in-person appointment only scheduling, and we also have virtual services. Of course, we were mainly in person prior to COVID, but as COVID came along, we made the pivot into where we're offering virtual services. And with child and adolescents, most caregivers choose to go the virtual route, but we're available for in-person services as well. I have listed the days of the week as well as the times for each of the locations and when they are in operations. And I will share this PowerPoint with Ms. Harris so she can share if anyone is needing additional information or just access to the slides in general. And just what is required when people are coming into services anywhere, just bring whatever you have as far as insurance card, ID. Of course, if the person is under 18, then they have to have their parent or guardian with them. We also ask people to bring a list of their medications, any supplements that they're taking as well. We take referrals from any agency if someone in the community is working with someone that they know in particular needs some behavioral health assistance. And then we certainly will receive that referral from that agency. And if that agency and the client agree that there should be, communication between the therapist and themselves, then the client and their parent or guardian will have to sign a release of information. And so just to go into our programs to give more details. So we have the Recovery Support Clubhouse for Youth. And the Clubhouse for Youth is a really neat program that is for 13 to 18-year-olds. And they operate during non-traditional hours, so typically after school. And the focus there is really teaching the adolescents how to live a healthy and sober life. And so they take in clients who may struggle with substance abuse or on the brink of, at the beginning of having an addiction to a substance. And so there they learn alternative life skills, social strategies. They have groups, they go on social outings, they go everywhere around Atlanta. And it's just a way to introduce them to living a life outside of drugs. We take a lot of referrals from other agencies, whether it's juvenile justice, whether it's a probation officer, but they take in those clients who are eligible for that program. They have career development, nutritional, educational classes, tutoring. They have a lot of fun at the Clubhouse. Transportation is provided as well. They typically pick up the clients from their home, bring them to the Clubhouse, or take them to wherever their outing's going to be for those particular days. And so they offer everything in a group setting, and that's around substance abuse prevention, some behavioral health, psychoeducational classes, daily life skills around cooking, budgeting, time management, health and wellness as well. And they play games there at the location. There's also, like I mentioned, homework assistance, tutoring, as well as customized employment preparation. And then we also really try to include the family in their experience. So the families can learn right along with their adolescent, so they know how to talk to their adolescent when they're having issues, as well as participate in the fun activities that they have there at the location. Upon completion of the program, we really ask for the graduates to come back and mentor the current clients that are participating in the program. And so it's a very well-rounded program. And again, it's offered during non-traditional hours. And so we're always excited about the work that's going on at the Clubhouse. An additional program that we have is a part of our school-based program is Text for Help. We've partnered with an agency called Linking Effects Against Drugs. And what it does is it enables public, middle, and high school students within Fulton County to access a confidential text line free of cost. And so the text numbers are provided through the schools, and those students can text a licensed clinician 24 hours a day, 7 days a week. If they're having any concerns. Very oftentimes there may be an adolescent that sends a text because they're concerned about their friend. Those clinicians are on the other side, and they talk to those those students as long as they need to, or a short amount of time as they need to. Of course, they're gonna, connect them to resources, but also just be someone that they can talk to. Our response time is within 3 minutes of the receipt of the text. And it is confidential, not anonymous, but it's confidential. And then another school-based program that we have is that there is actually school-based mental health therapy within Fulton County schools. Currently, they're in about 60 schools, and that number is growing steadily. By the end of the spring semester, it's our expectation to be in 68 of those schools. And those services are currently provided by Chris 180 as well as Summit Counseling, and is through a referral from either the school counselor, the teacher, or a staff. And those clinicians are within the school, and they provide individualized therapy to those students. And they also offer both virtual and in-person sessions, because we've now gone into some of the schools that are just online schools in general. And that is it around our programs. That is my contact information. And so, yeah, those are our programs: Text for Help, school-based therapy, outpatient behavioral health services, Clubhouse for Youth. Those are the services that Fulton County offers. And as Ms. Harris was saying, from our perspective, the services, we're not at capacity in any of these programs. And so we definitely want to be able to continue to share the news that, Fulton County offers these services. And it's really important for us to continue having conversations around mental health and behavioral health, because very often we hear, let's break the stigma associated with mental health. And the only way that we can break that stigma is have conversations. And so as we continue to have conversations, we continue to talk to people about the resources that are out there, because we hear people say there are no resources, I can't access services, but the services are there. It's just a matter of being able to tap into those when you need them.
Well, thank you very much for the presentation. A lot of good information that you provided. One question that I do have for you is that, I was looking at the locations, and obviously we have, I know there is a location, I think it was on Metropolitan, that was closest to the South Fulton area.
Yes.
Is there any plans to expand even further south? I mean, when we have a lot of communities that are, the Palmetto areas, within Fulton County, Fairburn, and those areas, sometimes transportation is not the best.
Right.
Getting to those locations, are there any plans to expand the services a little bit further south, or is that part of what the virtual platform will help take care of?
Yeah, not that I'm aware of currently, but there are always things going on behind the scenes that I'm not necessarily aware of. But definitely with us being able to offer virtual services, takes away that transportation barrier, because we totally understand that people are having to travel far. The funding may not be there. And so certainly us offering services over a virtual platform, it has definitely bridged that gap with people experiencing transportation concerns.
Okay. And also, I know Chelsea Montgomery with Fulton County, I was at a school where she did a presentation, and she talked about the expanded resources that were coming within the semester to help support the students and families of Fulton County.
Yes.
As far as what are some of and I know obviously with HIPAA, you can't say anything, but what are some of the more common things that you're starting to get calls in, or have you noticed the increase in phone calls to support the coming from the South County area?
And I don't typically, when we get the numbers, it's not broken down based on area necessarily. But from my understanding from the Text for Help data, it usually centers around someone concerned about their friends wanting to hurt themselves. And so definitely more conversations around suicide prevention, suicide education, and really having those conversations. Very often people are afraid to have those conversations because suicide is scary. But asking asking a person if they feel suicidal doesn't cause them to want to, commit suicide, but just having those conversations are important. So that's very common what has been coming up as far as people, other students being concerned about their friends that may be having some suicidal thoughts.
Right. And then and also to speak just a little bit on some of the things that have been occurring recently, where we have acts of aggression in the schools with violence, in particular, referencing the situation that happened at Banneker High School. Yeah. And I know they had their panel discussion about it on Monday. Mm-hmm. But, when I look at things like that, two parts. One, where we have issues of kids who are not accustomed to the trauma that they're seeing playing out in front of them, mm-hmm. Having resources for them, in addition to those kids who are going through situations where they have a lot of aggression. Mm-hmm. Can you speak to some of the programming that may be able to help, the kids that in the families that are in both of those buckets?
Right. The thing is to seek the resources. Very often, people have concerns about their children, and, you talk to them kind of in passing, or you want to pray, that, things get better with them. Really, the thing is to be proactive and take action when we know that something has changed. with your child. You know, in the home, you know your child best. Teachers know their children best. You know, the students that they have best. And so my recommendation is always to take action. Again, there are services within the school. And then the parents always have access to services. Always, you know, it's better to be proactive than reactive. It's always safe to assume that if someone has experienced something traumatic that is going to affect them, it may not, you know, manifest itself early on, but it may come later. So it's better to get that help, you know, very early on, just so it's the tools have been established to where when something does affect them more, they've already established that line of communication, that they're already in therapy, and so they know how to respond when things happen.
Right. And then just for, people who watch a little bit later, what are some of those things that, because this age range, we get a lot of like, oh, they're going through puberty. And, and I always tell people like, oh, you can't blame everything on puberty.
Right.
Can you just review some of those things that parents should be kind of more keyed into about, like, if they notice changes in their kids, that should say like, hey, let me go ahead and call and get my child an evaluation.
Right. So typically, just responding more emotionally about something that would typically not be a big deal. So like asking your child to do something and them kind of flying off the handle. So them it's displaying anger. There's typically something underlying with that. Them being more reserved and closed off. And we know typically teenagers are in their rooms all the time, but asking them to come out and having a conversation around, anything going on with you, so asking those probing questions is going to annoy them, but certainly asking those questions. So any changes in pattern around their behavior, their friend group, things that they typically enjoy that they're not interested in anymore. So someone that used to hang out that doesn't want to hang out anymore. So just any changes of behavior, really paying attention to that. Schoolwork changing, where they may have been doing well in school and now their grades have fallen apart. So just any of those slight changes. It could be something or it couldn't be, but it's better to check into it just to see what's going on, and really making it really normalizing having mental health concerns, right? Because when you start to talk to children sometimes about, I need you to go see a therapist, like, I don't want to talk to somebody about that. So making it real for them, that, so like if you're getting help too, like that's the best way. So when, I got therapy because I was going through this. So making it really real for them, or when I'm having trouble, I talk to my friends and they know what's going on with me. So normalizing it for them and letting them know that it's okay to share their thoughts and feelings with someone else, just to be able to get to the bottom of it. And also just to be someone else besides the parent, that they can open up to. So that helps too. And then parents just being open to the process, that it may be, oftentimes there may be some things that a parent may need to alter at home in, how they're processing information with their adolescent. And so just being open to that. I always, recommend that to parents, that some of the homework may come back to the parent as opposed to just the student, but just being open to that process, and that any little bit helps to get the person better.
Excellent, excellent. I know one of the things I always, try with my son, I was like, hey, did something make you, was something funny today? Did something make you laugh? Did something scare you or catch you off guard? And he looks at me like, why are you probing and asking all these questions?
Yeah.
But sometimes I'll get these unique little conversations and I was like, tell me a little bit more about that, And so just, having that casual conversation. Also, like obviously with some of our kids, they are witnessing their parents, going through stresses and changes. What is it, this number that you have access to call, is that way somewhere they could just say, hey, like, I'm concerned about my mom, my dad, or my caretaker, being able to do at the other end. So many times, I think kids, we may not empower kids to say like, hey, if you're concerned about your parent or your guardian or whoever is helping support you, making sure that they have an avenue to help get them help as well.
Yeah, absolutely. And I like the back doorway that you're having a conversation with your son. That's really important, because it's like, okay, so instead of just come out and saying what happened in school, asking it in a different way, like, what did you like, or what didn't you particularly like about today? What was different about today? So instead of just saying how was school, and their typical response is okay, just going a little deeper. Well, what's okay? What does okay look like? So just asking, trying to kind of go in the back door to initiate that conversation. But yes, certainly any concerns that a student is having, that text for helpline, they're going to be able to talk them through that process. Because sometimes that is what students experience. They're seeing their parents go through things that the parents aren't necessarily talking about. And so we can get help from our own children as well. And so I think that's really important that you made a note of that. Yeah, any issues, any concerns, definitely that text for helpline receives those.
Excellent. And so I know we're getting close to wrapping up the time for the program. Any other final thoughts that you want to share with the team? I don't know if definitely want to, if you could put that final slide that you had up there with your contact information and the number for people to reach out. And I think the key is to make sure that everybody just call the number and just let them know what's going on, and then they can help guide and direct you to the next best steps.
Yeah. Yep, certainly. So coming up. Yeah. So that's my contact information, my email address, and my office phone number, as well as my county cell phone number. And so again, I like to use my superpower, as I mentioned, of connecting people. So anytime I get a call, whether it's behavioral health directed, whether it's inside Fulton County, outside of Fulton County, I don't mind stopping what I'm doing and making sure that people get connected to where it is that they need the services at.
Excellent. Well, I want to thank you again for taking time to come out and doing this presentation. I know, it was kind of like one of those like last minute, like, hey, oh my goodness, can we get somebody to come in from the county and discuss the services that they offer? And then, like I said, again, I want to reiterate to people that, their services are available. And also the other number that you provided was 770-722-0080, which was the number that people can call in to talk about getting an appointment to receive services. For those who have come in late, you can always view this broadcast after it's posted on the South Fulton Mental Health Facebook collaborative site. And just want to thank Ms. Williams-Walker again for taking the time to come and speak to us and providing us some valuable information. If you all, also one thing I will work on getting put on there is the text for help, the information from Fulton County Schools, so people can be aware of the information and share it with their kids to provide it. So if they have any issues going on, that they have outlets and resources to initiate the process for receiving help. Yeah. So once again, Ms. Williams-Walker, thank you for sharing this information. And I want to thank everybody for tuning in. And please, if you have any comments later on, drop them down, and we'll make sure that Erika's information is also in the chat box as well. And we can get this, in this presentation will be available on the platform. So you all have a great rest of your day and enjoy your week. And thank you again for joining us. And next month, we will, I'm not sure what date it will be, but we will put out information for our next presentation for March. And then also, like I said, as always, please utilize South Fulton Mental Health Collaborative Facebook page as a source for resources for your mental health services in the community. So thank you again, and you all have a great day.
Thank you.